Okay, Alice, I understand that you as Oxfam launched an international report last week. Can you tell us about it, please, and what you were calling for?
Yes, so last week we launched a report called Dignity, Not Destitution, and it's basically trying to highlight the economic fallout of the coronavirus, the COVID-19 crisis that we are all globally managing and struggling through. And I suppose a lot of focus, rightly so, has been on the necessary steps we've taken at society level in terms of social distancing and lockdown to prevent the spread of this disease, which is really important and really key that we all play our part. And for us as an international aid agency, our communities on the ground, the people we work with in some of the poorest and most vulnerable communities in the world, they're also struggling to implement these safety precautions in refugee camps where social distancing is impossible, and in urban slum areas where it's very difficult, and also in countries where there aren't the same social protections that we have, sick pay and severance pay and temporary layoff schemes. And so we did some research to look at what will be the economic fallout for the world, and especially what will that mean for the world's poorest. And it had some very frightening findings. I suppose the main one being that the coronavirus could push as many as 500 million people into poverty and really undo some of the great strides that we've made in reducing poverty over the last 30 years. You'll know that since the Millennium Development Goals, we had collective successes in halving extreme poverty over 15 years, and we were working to eliminate it altogether. And so this global pandemic could push 500 million people into poverty and undo some of the successes that we've had in the fight against it.
And since you launched your report last week, the G20 have met, haven't they, and discussed these issues, have they?
Yes, so there were a number of key meetings. We launched the report ahead of a number of key meetings of the World Bank, the International Monetary Fund, and the G20 finance ministers, which were happening across this week. And I suppose we launched it ahead of that because in order to mitigate this economic fallout that will really have a disproportionate impact on the world's poorest, we had a number of asks. So we were asking for an economic package for all. So as countries understandably have to look internally and what this will mean for our own individual, national economies, our workforce, our numbers of unemployed, all of that. We were asking them to also think internationally and stand as an international community on behalf of the world's poorest. So the package includes an immediate cancellation of about $1 trillion worth of developing country debt payments in 2020, and also the creation of at least $1 trillion in new international reserves. So these are known as special drawing rights to dramatically increase the funds available to countries. So just to give you an example, if we were able to deliver $1 trillion worth of new international reserves, this would give the government of Ethiopia an additional $630 million, which could increase their health spending by 45%. So being able to implement these measures means poor countries will be better able to respond right now and in the future to this pandemic.
And when you say a trillion, has $1 trillion in debt payments been cancelled or just postponed?
No, that's what we're calling for.
Okay. So
that's one of the asks within our economic rescue package for all, in order to keep poor countries and poor communities afloat.
Do you as an Oxfam welcome what the G20 agreed recently?
So at Oxfam, we think the announcement by the G20 is a very critical and needed step, and it will help poor countries to free up billions in funds so that they can tackle the coronavirus pandemic. However, the UN estimates, and as our report dictates, that developing countries will need $1 trillion in debt suspension and cancellation to truly weather this storm and stay afloat. And many countries, such as Lebanon or Ecuador, they were left out of this deal when they too need money to save lives and cope with the global economic fallout that the IMF itself has said is the worst since the 1930s Great Depression. And so while this is a really important move by the G20, we say that far more needs to be done to rise to this moment of unprecedented need and ensure that we are able to save millions of lives. So we would say that they must not allow the suspended debt payments to accrue into the future. They must cancel all of the 2020 debts of all the countries that are being hit by this economic tsunami, and all creditors must follow suit urgently.
It must be a very challenging time for your workers in Oxfam, Alice, your colleagues and the people you're helping in developing countries, is it?
It is, yes. I mean, I think we are used to the frontline responders in times of crisis being our workers on the ground, and we really recognise that the frontline responders now are people here as well. It's our healthcare workers and the people who keep our supermarkets open and those doing deliveries. And so I suppose in a way it's amazing to see how this crisis has highlighted our interconnectedness and our solidarity and how we just really have to stand together, and we're all in this together. And I guess that's what our report, Dignity Not Destitution, speaks to. It's saying that we can't say we're all safe or we're all okay if that's not true for the poorest and the most vulnerable among us. And so for our workers on the front line, they're facing very challenging situations. For our staff and partners on the ground in refugee camps, it's impossible for people in large-scale, crowded refugee camps with inadequate water and sanitation facilities to really protect themselves during the spread of a virus like COVID. So we are ramping up our water and sanitation programs. We're trying to make sure that people have access to clean water and safe sanitation and toilets and showers. We have drawn down some funds and are working with Irish Aid in the Gaza Strip to help turn schools into quarantine centres and make sure that they have the right health infrastructure to respond should COVID rapidly spread through the Gaza Strip. But it is a very challenging time, and I suppose we're not able to raise funds in the way that we always would have. We tell people the stories of those in need face to face at people's at people's homes and on the telephone and through our network of shops, and they can't operate as normal at the moment. And so we would just say that people in the world's most poor and vulnerable communities really do need our support right now, and encourage people to donate if they can.
What would you say to the argument, Alice, that we should simply look after our own people in Ireland when it comes to the coronavirus, and if developing or poor countries are struggling, that is a matter for solely themselves?
Yes, I think I would say that now more than ever we can see that type of attitude is not true. I mean, COVID has shown us that we are all in this together. This is a global pandemic. It's a global threat. It's threatening the lives and the livelihoods of people in Ireland, but also in the UK, across Europe, and across the world, including in the countries where we work in developing countries. So I think that really has this global pandemic and this global crisis has really turned that kind of thinking on its head. It showed us that we're more connected than we thought, and that now is a time to stand together more than ever, and actually to work in silos or in an insular way, only taking care of ourselves, will not end this pandemic, and it will not protect everybody's lives and livelihoods. So I think we really have to have a global and an international and a solidarity outlook at a time like this more than ever.
Bill Gates,
Okay.
I don't know if you saw, but Bill Gates wrote an article recently, and he really spelled it out. I think that he said that even if in the Western world the coronavirus is brought under control, if it spreads widely in developing regions like in Africa and South America and Southeast Asia, that it'll basically come back to the Western world anyway, be through people traveling from those countries. So I'm not sure if you saw that article, did you?
I didn't actually know.
Okay, yeah, it just goes to show you how we're all interconnected.